Clinicals are so critical to nursing students. You might have an A in your theory class, but if you fail your clinical, it's a fail for that class altogether and you have to repeat it, or you're even kicked out of the program. In today's video, I'll share with you guys some clinical tips and what to expect during your nursing school clinicals. And by the way, if you're new here, welcome. It's so nice to have you. If you're not new here, thank you so much again for tuning in. If I look down, I'm gonna have my iPad right here reading all the notes because I want to be as thorough as possible. Now, let's just get started with what to expect during clinicals. Since I graduated with my associates in nursing, I've had 2 years of clinical experience through all my clinical rotations, and I'll be sharing my tips on how to prepare and be successful for your clinicals. So in nursing school, there's the theoretical part of it and the clinical part of things. And during your theory is where you learn about all the pathophysiology that you need to know, all the nursing skills that you need to know, all the diagnosis that you need to know. And then what you'll find is your clinicals for the week usually go hand in hand with whatever chapter or topic you cover during your theories. So let's say, for instance, you learn about airway and your skills checkoffs are going to focus mainly on, let's say, oxygenation, tracheostomy care, and then once you go to clinicals, your professor or your clinical instructor will try so hard to give you a patient who has all of those diagnoses combined so that you can have hands-on experience of your theoretical knowledge. I used to think, you're just taught in class, then you're thrown into the hospital to just take care of patients. But actually, before or prior to you having your clinicals at the hospital, there's something called simulations and skills checkoffs. So first of all, once you cover a topic in class, you're gonna have simulation hours whereby instead of that one clinical hour for that week to go to the hospital, you're gonna go to your school sims lab and you're gonna be able to practice these skills with your instructor. They're gonna take you through all the skills on how to perform their skills within that topic. In the beginning of the semester, you're going to have your list of all the skills checkoffs that you have to complete for the semester, so that after each simulation, during whatever time you're available or whatever you have some downtime or some free time, you take yourself to the simulation lab and you practice those skills by yourself, whereby the sim lab nurses will watch you and check you off as you go once you get them right. So the goal is to always complete this checkoffs prior to going to the hospital for your clinicals for that next week. Let's move on to clinical day. So during clinical day, you're gonna have very long shifts. Hours used to be from 6:30 to at least 5:30, and then from 5:30 we're gonna have some debriefing with our cohort. Once you get to the hospital, prior to having your patient assignments, you meet with your cohort, you discuss the goals for the day. Usually the goals for the day are to practice the skills that you practice in the school sims lab and your checkoffs. This is also where the instructor gives you your patient assignments for the day, tells you which nurse you're going to be shadowing for the day, and so forth. So during clinicals, being that your professor already saw that you completed your skills checkoffs for that week, they're now going to assign you to the patients within that population and expect you to perform certain tasks. Let's say during your simulations and your checkoffs, you practice your finger stick techniques. So during that clinical, your professor is going to make sure you do at least one finger stick or however many finger sticks they're going to be available, just so you can practice on a live patient. And that's something that I really loved about my school, is that they want to make sure before they just throw you out in the hospital to perform all the skills on live patients, they want to make sure that you've done your part, you've done your simulations, you've done your checkoffs. One thing I forgot, together with your simulations and your checkoffs, you're also given assignments or videos to watch and supplement your knowledge and actually watch these skills. We used to use ATI, and ATI had really great modules where you'd watch all the skills step by step, do a pre-test and a post-test. So all of this is just to make sure that you really grasp the techniques being used. Together with you performing all these tasks in the hospital, the professor also expects you to create care plans for the patient that you're going to be assuming care of. So, the care plan following the nursing process, you have to assess them, you have to read up their diagnosis. You have to come up with a treatment plan for that patient, what your goals are for the patient. You have to state your interventions given that patient's diagnosis. And finally, what are you going to do for evaluation? So you have to form a care plan based on which patient the professor gives you to focus on, and that's going to be your assignment during clinical, which leads me to the next point, debriefing. At the end of clinical, you always meet with your cohort in a conference room, discuss about your patients, discuss about your patient's care plans, and this is where you quote unquote get to present your patient. This is where you share the assessments you performed, the patient's diagnosis, what your plan of action for the patient was, what interventions you performed, and also what you did to evaluate whether they're getting better or deteriorating. And finally, you never leave clinical without assignments. So we used to have something called the clinical evaluation tool. This was about a 5-page document that you have to fill out based on that day's clinical. It had certain prompts like, what did you do to show that you were accountable, or what did you do to show that you participated in a legal or you followed the nursing ethics? What did you do that was evidence-based practice? And this is done to log in your clinical experience per se, because as nursing students we are not really charting about the patient, so this was quote unquote our way to chart about our patients for that clinical. And that is it. I think I've covered everything on what to expect. Let's move on how to prepare and be successful for your clinical. What I usually like to do the night before my clinicals is to log into my ATI modules or whatever resource you use and watch those skills videos. This is handy because you want to study your patient population so that you're aware of what type of patients that are brought to that unit. Let's say, for instance, you're in a med-surg unit. You want to learn the most common diagnoses being brought to that unit. Let's say, for instance, the most common patient population is heart failure patients. You want to log into your ATI, read up the medications, watch any skills that they may be, and this just prepares you for the next day. And I feel like it eliminates some fear, which makes you focus even more for what you're there to do. Because I feel like if you're going there unprepared, you basically are just lost. Your mind is not going to be so focused on what your tasks for that day is. Rather, it's going to be focused on, oh wow, I don't know this. You're just going to be questioning yourself a lot. You're going to be in your head a lot. So just eliminate all that by preparing, watching videos before your clinical just to prepare. And I also like to print out all my clinical tools that I need, and this is usually the care plan tool and the evaluation tool. And once I have these two documents, I'm gonna definitely use the care plan during clinical because it's expected to create a care plan for the patient. And what I like to do for my evaluation tool is to just jot down and fill out the prompts as I go throughout the day, write a draft with a pencil of what I'm going to be typing when I get back home, because then I don't want to forget. Immediately, if I perform something that's evidence-based or if I see something that's ethical, I just write it down quickly so that when I get home, I like to do away with my assignments the same day just so I don't forget what my clinical experience was. The next thing is to prepare your clinical stuff ahead of time. Prepare them the night before. Prepare your uniforms, prepare your lunch, your snack, your water, prepare what you're going to be taking with you. And by the way, feel free to watch this video up here about what to take to your clinicals if you're not sure what to bring with you, because the whole world will try and tell you you need a million things. You need to carry the whole world with you to clinical, but no. You only need a few things. You're only there for a few hours. Well, it's not really a few hours, but you're just there to learn. So click on that video if you're not sure what to bring. I went step by step on what I usually bring in my clinical bag. And yes, you want to prepare all that the night before, just so that when you wake up the next day, being that you're waking up very early, it's just you getting ready and leaving. You have to also account for your commute time, and you always want to be early. My second to final tip is to sleep early. so that when you wake up in the morning, you're feeling rejuvenated, you're feeling fresh. As hard as it may be as nursing students, because I know we always have a million things. You can have clinicals the next day, and literally after the clinical, you've spent a whole day at clinical. Following day, you have exams, so you want to pull all these all-nighters. Please don't. Please don't pull an all-nighter before clinicals, because then you're just going to zombie walking through the hospital, and it's not going to work. Clinical instructors are very strict. If they see that you're sleepy, tired, or you're just sluggish, they consider you at risk, and they can even send you home for that, because then you don't want to be at risk for any harm or danger to your patient. And they don't want to mess up their license, because when you're in clinical, you're working under their license, so they're protecting their license at all costs. So just keep that in mind. And the last tip is wake up early. Well, be early. If they say you have to be at the clinical site at 6 a.m., be there 15 minutes earlier. Be there at 5:45. This shows that you're well prepared. It shows that you're ready to learn. It shows that, you're just ready to tackle up on that day. I usually try to keep this in mind. Being early is on time is late, and you don't want to be late. And yeah, those are all my tips on how to prepare for a successful day at clinicals, and also what to expect if you've never had any clinical experience. I hope you learned something from this video. If you follow those tips, I guarantee you're going to be successful in your clinical. I might do another video on how to actually pass your clinicals, because clinicals are so critical to nursing students. You might have an A in your theory class, but if you fail your clinical, it's a fail for that class altogether, and you have to repeat it, or you're even kicked out of the program. So it's just very tricky. It's about how you conduct yourself. It's about how you form relationships with your professor, with your cohort mates, and even the nurses in the hospital. So anyway, I'm going to do another part 2 of this video on how to actually be successful during your clinicals. And I hope you stay tuned. Thank you so much for watching. See you in the next video. Bye-bye.